My name is Veda, and it is very nice to meet you. So I was looking at your records, and it looks like you're here with a referral from your primary care physician. Is that correct? Okay. Just pull out your chart here. Now, I see that they referred you to us because you've been experiencing some frequent headaches. Okay, yeah. And it looks like you did have a full physical exam recently, and you otherwise were in very good health. I don't see any issues noted. Is that correct? Okay. So what I am going to do today as a neurologist is go through and just do a brief exam, ask you some questions about how you've been feeling in general, any possible medical conditions or underlying factors will be looked into. Then we'll talk more specifically about your headaches, the duration, frequency, symptoms, stuff like that. And we will try to determine the cause and the best way to treat those, because I know they can be very, very uncomfortable. Okay, perfect. So first, I'm just going to ask you some brief questions. What is your date of birth? Thank you. And we already said that you're here for the headaches. Any other issues you'd like to address while we're here? Okay. Well, we'll stick to the headaches then and any associated symptoms. Now, have you had any fever, chills, sweats, or fatigue recently? And that can be with or without the headaches. Okay. And have you experienced any blurring of your vision? Okay. Any doubling of your vision? Okay. Eye pain or vision loss? Okay. That blurring of the vision, does that happen mostly when you have a headache? All right. Any sensitivity to light? Okay. And is that also with the headache? All right. Have you had any hearing loss, ringing in the ears, or trouble swallowing? Okay. Chest pain, palpitations, dizziness, or lightheadedness? All right. How about any cough, wheezing, or shortness of breath? Okay, good. And any nausea, vomiting, diarrhea, or constipation? All right. And is that generally when you have a headache or at other times as well? All right, that's with the headache. Yeah, these certainly sound like migraines so far. How about incontinence, frequency, or blood in urine? Okay. And then in terms of possible musculoskeletal issues, any back pain, joint pain, muscle weakness, muscle soreness, swelling, cramping, stiffness, okay. Rash, itching, dryness of the skin. All right. And how about any feelings of weakness, particularly in your body? Okay. Numbness or tingling? Any history of seizures? Okay, good. Have you passed out or fainted in the past? Okay. How about any tremors? Okay. And we already said the headaches and migraines, so we'll note that down. In terms of psychological conditions, have you been experiencing any depression, anxiety, memory loss? Okay. How about any suicidal ideation? Okay. Let's see. How about any cold or heat intolerance? Yeah, okay. But beyond the typical, have you found that you are much colder or hotter than those around you? Okay, good. Now, have you had any weight change greater than 10 pounds in the last month? Okay. How about any abnormal bruising or bleeding? Okay. Any allergies? Okay. And any other symptoms that I haven't spoken about? All right. Yeah, that could be. That sounds like it's related to the headaches. Now, how about any other medical problems? Asthma, blood pressure issues, history of cancer, high cholesterol. Okay. Diabetes, emphysema, heart attack. No, okay. Liver problems, osteoporosis. Yeah, that would be unlikely with your age. Let's see, seizure, stroke. We said no to seizure, no to stroke. Any history of ulcers? Okay. Yeah, I wasn't expecting any of those issues just because you did just have a physical. Any other medical problems that I haven't mentioned? Okay. And have you had any surgeries in the past? Okay. Do you smoke? Okay. And do you drink? How frequently? Okay. And how many drinks usually when you are drinking? Right. Are you living alone, with a significant other, with children, roommates? Okay. And do you drink caffeine? Alright. How much caffeine do you consume on a daily basis usually? Okay. Alright. So for family history, let's see, mother and father, are they living? Alright. And how about any notable medical issues that they have experienced? Okay. Yeah. Yep. Alright. How old are your parents? Alright. Yeah, when was the onset of the medical condition? Yeah, okay. How about any siblings? Okay. Any notable medical conditions? Okay. Thank you so much. Alright. So, in terms of your medical history, and I know your primary care physician probably said the same thing, I don't see anything notable in your history that would be causing these headaches as an underlying factor, and that's often the case with something like migraines. So with some of the symptoms that we are talking about, it does sound like this is most likely migraines. If I determine that there could be other causes, we could do potential tests such as an MRI or CT scan to look at anything that might be going on as an underlying factor. Now, in terms of the headaches that you're experiencing, at what age did you start having headaches? And have they increased in frequency or decreased? Okay. Have you ever been treated for migraines in the past? Okay. Oh, so you've been dealing with this for quite a while now. How many days a month do you have some form of headache? All right. And that is really frequent. And has that been going on for a while, or has that increased by a lot recently? All right. And are you taking any over-the-counter pain medicine for these headaches? Yeah. Does that work for you? Okay, yeah, we can try to find you something a lot better then. Let's see. So we said many times per month. When you do have a headache or migraine, how long does it take for it to go away? Okay. Yeah. And do you currently have a headache or migraine? Okay. Now, unfortunately, the test that we do today can be triggering for some people because it does involve some lights in your eyes. Hopefully, we'll be able to find a treatment for you that will help with that if we do end up triggering a migraine today. Usually we can. Let's see. So we've talked about how long they last. Now, different types of headaches usually have different types of pain associated with them. Would you say that you experience a throbbing or pulsating pain? Okay. Pressing or squeezing? Stabbing? Dull or nagging? Okay. And any other type of pain? Okay. Does the headache ever wake you from sleep? Okay. And does your headache usually start in a certain particular place on your head? Okay. Okay, yeah. Is that usually on one side or the other, or does it seem to switch? Okay, so typically right eye socket, but it can switch, and it can be other places. Where else? Okay. How many headaches each month would you say are mild? Okay. Moderate and severe. Okay. And on a scale of 1 to 10, 10 being the worst, how would you rate the severity of your average headache? All right. Yeah, sounds like you're very uncomfortable, you poor thing. Now, these headaches often come with accompanying symptoms, especially migraines. They present with certain symptoms. I'm going to read you a list of associated symptoms, and I'd like you to tell me which ones apply to your headaches. So, if you have these symptoms when you have most of your headaches: nausea, vomiting, light sensitivity, and that one's pretty typical, noise sensitivity, okay, loss of vision, flashing lights, visual blurring, double vision, tearing of your eyes, nasal congestion, drooping eyelid. Alright. Strange visual patterns such as zigzags, sparkling, shimmering, or colored lights. Difficulty speaking. Difficulty understanding what people are saying. Numbness. Weakness. Dizziness or vertigo. And do you ever have warning symptoms 20 to 30 minutes prior to a headache, such as seeing an aura? Some people maybe have the blurred vision before then, or even smell something. Okay, yeah, and what does that look like? Yeah. That sounds really typical of an aura that one might see before getting a migraine. So that can be a pretty significant warning sign that a migraine's coming on. And I know that your primary care doctor had asked you to keep a log of what you're eating, what you're doing, and see what might be triggering some of these headaches or migraines. Now, did you have a chance to do that? Oh, awesome. Okay, that's great. Let's see. What seems to be bringing on your headaches? Insufficient sleep? Yeah. Changes in the weather? Loud noises? Exertion? Missed meals? Odors? Stress? Okay. Bright lights? Okay. Yeah, so we might trigger a migraine for you today. I'm so sorry. How about alcohol? Okay. Motion sickness? Any particular foods? Okay. Yeah, some people find they can be triggered by things like chocolate, other foods. I'm going to give you a list of foods that can commonly trigger a migraine. They might not be triggering for you at all. Might be something to look out for though. Now, in terms of medication, You said you've never been treated for migraines in the past, so I assume you probably haven't had any abortive or preventative headache medications prescribed to you. So that would mean an abortive medication is something that you take after the migraine has started. Preventative is something that you take consistently to prevent the headache or migraine. Okay. Yeah. Yeah, we prescribe both of those types of medication here, depending on the symptoms that you're experiencing. But for you, because of the frequency and duration of your migraines, as well as the severity, I think you would probably be better served by a preventative medication, something that you take daily to keep you from getting those migraines in the first place. If you were only getting them maybe once a month, then the abortive medication would work just fine. But I think getting you on a regimen of something that's really going to prevent those is going to help. Where you are experiencing a lot of the typical migraine symptoms, such as localized throbbing pain, like you said, in the right eye most of the time, though it can be in different spots. The halo, sensitivity to light, sensitivity to noises, nausea, all of that stuff. This does sound like chronic migraines to me. So, just to be extra sure that we don't see anything else that we need to take a look at, I am going to do a neurological exam, and if I don't see anything that is concerning at all, we can go ahead and get you prescribed that medication, and you can start it immediately to alleviate these symptoms, okay? Perfect. So, first thing I'm going to have you do, nice and easy, is just go ahead and stare at my nose. Yeah, just right in my nose. And don't move your eyes at all. You're staring at my nose. Good. Alright. And now I have my fingers. I'm going to have you go ahead and tell me which finger moved. Good. Which finger moved? Good. Which finger moved? Very good. Which finger moved? Good. Which finger moved? Good. Okay. Now I'm going to be coming in towards your field of vision, nice and close to you, like this. And you can tell me when you can see my fingers and which one moved, okay? Which one moved? Good. Good. Which one moved? Good. Which one moved? Good. Which one moved? Good. Okay. Now I'm just going to look at each of your eyes for a second. There is a little light here, so I'm sorry for the brightness. I'm just going to come in a little bit closer and get a good look at your eyes, okay? Alright. Left eye looks good. Lovely. And right eye looks good as well. Okay. Thank you for your patience. I know it can be a little bit uncomfortable. Now I'm just going to dim the room a little bit for the next set of tests, okay? Alright, it won't be too dark. Okay, so just a little bit dimmer. Now for this next set of tests, I'm going to have you start by looking at the wall behind me. So just stare at the wall behind me. I am going to look into your eyes again with the light, but I don't want you to look at the light, okay? Perfect. Now I'm going to gradually move in, so just look at the wall behind me. Okay? looking at the wall behind me. Good. Back to your left eye one more time. Good. And one more time. Excellent. All right. Looks good. Now I'm going to look at your eyes from an angle. Come over here. Okay. Alright, that looks good. And the other side. Okay. Very nice. Now I am going to shine a light in your eyes, and I'm going to be examining your pupillary reaction to the light. Okay, so go ahead and look right at me. Do not look at the light. Right at me. Good. 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 Again. Good. All right. Keep looking at me. Keep looking at me, not at the light. I know it can be kind of hard because it's right in your eyes, but you are doing a fabulous job. Okay. Now I'm going to have you follow the light, okay? Yep, just keep your head nice and still, okay? Don't move your head, just follow with your eyes. Good. Okay. Great job. Eyes look really good. I'm seeing smooth tracking. Nothing that concerns me there. Alright, now I'm gonna have you tell me when the light is at its brightest, okay? Ready? Good. Coming back. Good. And again. Good. And coming back. Good. Okay. And other side. Same thing. Tell me when it's at its brightest. Good. Coming back. Good. Coming back. Good. One more time. Alright. Fabulous. Okay, now it's totally up to you. I can turn the lights back to their full brightness, or I can leave them a little bit dimmer. Hopefully let your eyes recover a little bit so that you don't have to get a migraine maybe. Alright, I'll leave them dim then. Okay. Can you tell me how many fingers I'm holding up? Good. And now? Good. And now? Good. And now? Good. And now? Good. Okay. Now, did they seem blurred at all to you? Any double vision or anything? Okay. So that's good. Yeah, your eyes seem okay, which also leads me to believe that it is a symptom of the migraine when you experience that blurred vision. Okay. And just follow my finger. Very good. Follow my finger. Good, 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 good. Thank you. And in. And out. In. And out. All right. Eyes look great. Now I am going to gently touch you, very gently, with this little cotton pad, and this is in order to test sensation that you're feeling. So you should be able to feel this very light touch. It's just light and wispy, and if you don't feel it in certain areas of your face, that could be indicative of another neurological issue we need to look into. So for this part of the test, I will ask you to close your eyes. Go ahead. And I'm going to come in and just very gently touch you, okay? Good. Let me know when you feel it, okay? Good. 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 Very good. Okay. Good. Good. Lovely. Okay. You can open your eyes. So that seems good. You're able to feel the light touch. Now I'm going to touch you again, but this time I'm going to be using this slightly sharp end of the stick. Not sharp, but not light and wispy like the cotton ball. So I will have you close your eyes again. Same thing, just let me know when you feel it. Okay. Good. 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 Alright, you can open your eyes again. Very well done. Alright. So it doesn't seem like you're having any issues with physical sensation, which is good. Now I'm going to ask you to make a couple of faces so I can go ahead and take a look at your musculature in your face, make sure that we're not having any issues there. Can you go ahead and raise both of your eyebrows for me? Excellent. And just wrinkle your forehead. Alright. Frown. Okay, lovely. Now can you just show me your teeth in like a grimace? Alright. Now a big smile with teeth showing. Lovely. Alright. So that looks great. I'm going to have you close your eyes again, and I'm going to make a noise on either side and just have you tell me which side you hear that noise on, okay? You can go ahead and close your eyes. Good. 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 Okay. Now I am just going to make a noise with my mouth in either ear. Eyes still closed. Let me know which side you hear it on. Good. Good. Very good. Okay. You haven't been having any issues with hearing at all? Okay, good. I'm going to say some numbers in your ear. I'd like you to repeat them back to me. 36, 46, 15. Very good. 18, 42, 12. Good. 92, 14, 17. Good. 46, 92, 30. Very good. Okay. So ears don't seem to be an issue either, which is very good. Can you just go ahead and say ah for me? Stick out your tongue and say ah. Alright. Just look down there. One more time. Ah. Okay. That looks good. And can you just give me a good cough? Alright. Nice. Alright. Now I'm just going to put on a pair of gloves because I do have to do a couple touches on your face and shoulders, if you don't mind. We are almost done though, so doing great so far, and I'm not seeing any areas of concern. Okay. Alright, so I'm going to press down on your shoulders. Can you go ahead and shrug them for me? Very good. Now I'm going to feel along your neck, okay? Alright. Can you swallow? Good, thank you. Alright, do you feel any tension in your neck? Yeah. can feel that a little bit, but it's not much. Not really anything to be concerned about. It might be, do you work at a computer a lot? Okay. How's your posture? Yeah, okay. So if you do, try to focus on your posture throughout the day. That should help some of the tension that I'm feeling in your neck and shoulders. It might actually help you to get a massage or two, which is kind of nice. Now, I'm just going to feel around your head. Let me know if anything hurts or is uncomfortable, okay? Alright. So, nothing is uncomfortable right now? Okay. Good. And now I'm just going to go ahead and feel around your face, okay? I'm going to start at your forehead. Alright. And then down your cheeks, temples. Alright. Along your jaw. And then I'm just going to feel around your orbital bone. If you could just go ahead and close your eyes for me. Alright, so yeah, there's that right side where you generally feel a lot of pain during your headaches. I'm not feeling anything abnormal, so that's good. And then left side. Alright, yeah, so everything feels okay. I'm going to put my hands on your chin. I'm going to ask you to turn your head to the right first, and I'm going to try to hold your head, turn it for me. Very good. And to the left. Very good. Okay. So muscle tone seems fine. Now, can you just stick out your tongue and move it side to side? Good. Okay. Alright. This next part is another sort of feeling test, so I'm going to strike this tuning fork and then I'm going to touch your face with it. I just need you to tell me where you feel it, okay? Close your eyes for me. Thank you. Good. 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 Alright, keep your eyes closed. I'm gonna put the tuning fork next to your ear. Let me know where you hear it. Good. Good. Yep, that's right. Okay, very good. Now where? Yeah, that should be in both. One more time. Yep, in both. Now I'm going to move it back and forth. You can open your eyes. Thank you. I'm going to move it back and forth. I want you to just tell me if you can hear the sound moving back and forth from one ear to the other. Yeah. Good. Okay. That looks good. Okay, so the next test I'm going to have you do is just touching. So in this one, you will be touching your nose and then my finger. Nose, finger. So if I were doing it to you, if you could just put your finger up for me. Okay, so it might be boop, 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 and I'm going to be moving my finger during that. So you are going to be touching your nose, touching my finger, touching your nose, touching my finger, and the finger is going to move, okay? Alright, I'm going to use this finger because I just touched my nose with my other one. Now, okay, go ahead and touch your nose and touch my finger. Good. Keep going. Good. Good. Okay. Good. 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 Okay. Great. And then the very last thing I'm going to have you do, go ahead and rapidly tap your thumb and index finger like this. Okay. Very good. Keep going. All right. Perfect. You can stop. All right. So, in terms of the neurological exam, everything looks fine. I do not see any issues that might indicate some greater underlying factor that we need to do tests for. It looks like this is a case of chronic migraines, which, though very common, are very uncomfortable. So, I would like to start you on a preventative medication for those migraines. And this would be 1 pill every day in the morning. There are no serious side effects. Some people may experience increased headaches if it is the wrong type of medication. If this one doesn't work for you, there are many others. So let me know immediately if you are seeing any issues with headaches not subsiding, okay? I am starting you on one of the ones that I prescribe the most often, and this should really alleviate those issues for you. So you will not have the migraines. This should take care of the pain, the nausea, the aura, all of those issues, sensitivity to light, and it should also help prevent you from getting a migraine, even with those factors that possibly bring on your migraines, like stress and insufficient sleep. Of course, it is important to get your sleep, so try to make sure that we still do that, but this should help prevent the bulk of those migraines, okay? All right. So, just get that down here for you. And which pharmacy do you use? Oh, okay, me too. All right. Yeah, no, I love it because I can do my shopping there while I'm waiting for my prescription to be filled. Okay. Sometimes buy myself a little treat. You know, Target will let you know what you need when you get there, right? All right. So I will get that put in for you immediately. And you can go pick it up and start taking it as soon as possible. I would like to see you back in 2 weeks, just because of the frequency of your migraines. At that point, we should have an idea if this medication is working for you, and we can proceed from there, okay? So at the front desk, I'm going to have them schedule the appointment for 2 weeks out, and make sure to pick up that medication as soon as you get the chance, okay? All right. Do you have any questions for me? Okay. Yeah, if this one doesn't work, there's certainly many other medications that we can try, and other alternative types of treatments, such as Botox, to kind of paralyze the muscles that might be causing some of those migraines with their tension. So that's an option, but this medication is very effective. I find that many of my patients find massive relief when taking this, so that should help. Oh, yeah. So that is actually an abortive type of medication. So if you have a friend that's taken that and it worked, that's a really good one too. And if this doesn't work, we could potentially look into that. But like I said, with the frequency of your migraines, I think you would be better served by a preventative medication that you take daily rather than something that you take when you have the onset of symptoms. Yeah. Okay. So we'll get you up to the front, schedule that appointment, and just make sure you pick up that medication. Any other questions? Okay. Well, it was very lovely to meet you. I really hope that we're able to fix this with the first medication we try, and I hope that you find a lot of relief. I'll see you very soon, okay?